Don't underestimate the power you have in taking the time to listen to someone else. Listening is a superpower and we all possess it. And if we just take the time to listen to at least one person in our day, we have the power to change a life and to be able to give all that support. So if you haven't honed listening skills, do it, because it is such a precious gift, and it's a gift we all can give.
This is the Visible Voices podcast. I'm your host, Dr. Resa E. Lewis. In today's episode, my two guests are joining me for NPSA, that's National Physician Suicide Awareness Day. Dr. Kelly Holder is a clinical psychologist and the Chief Wellbeing Officer at the School of Medicine of Brown University. Attorney Corey Feist is a healthcare executive and CEO of the Dr. Lorna Breen Heroes Foundations. Now, audience, this is Corey's fourth time on the podcast. He has walked us through the journey from the untimely death of Dr. Lorna Breen in 2020 to the passage of the Dr. Lorna Breen Healthcare Provider Protection Act. We discussed the critical role of healthcare design in creating safe spaces, and also the importance to holding safe conversations to ensure the well-being of healthcare professionals. Trigger warning, this episode does contain explicit discussion of suicide. If this topic is distressing, please prioritize your well-being. Feel free to turn off the episode, returning at a later time, or not at all. Let's get to the conversation. Thank you both for joining the Visible Voices podcast. And importantly, we are dropping this episode on Tuesday, the 17th of September, which is NPSA. For those of you that don't know what that is National Physician Suicide Awareness Day. Kelly, I'd like you to take it from the start. And what does NPSA mean to you?
This day, I think it's really important. It's a day that we get to recognize the challenge of our humanity for physicians in terms of suicide and destigmatize things, make resources available, and talk about what our organizations can do better.
In the British Medical Journal 2024, this summer, there was a report in an article entitled Suicide Rates Among Physicians Compared with the General Population in Studies from 20 Countries, Gender Stratified Systemic Review and Meta-Analysis. And the conclusions from this article are that perhaps rates have decreased. However, those rates for women remain higher than those for men. Were any of the results of that report surprising to you, Corey?
No, for a couple reasons. One is we actually know that suicide rates among physicians in other countries are lower than suicide rates among physicians in the United States. I recently got a chance to speak with a group in the UK on their suicide prevention, and they said, well, yeah, it's bad here. We had like 3 last year. And I'm going, okay, it's a little different. So I think in some ways, the US data is a little bit masked there. So in that way, it's not surprising. The data on women, however, is consistent, irrespective of whether we're talking about the United States or around the globe. And for that, it's not a surprise at all. What I do think is a surprise for many outside of healthcare, and I would say even for many within healthcare, just not clinicians, is that the rate of suicide among healthcare professionals, doctors, nurses, others, is greater than the general population. I think that is a new concept still for many.
When you shared that statistic, I started thinking about the multitude of roles women carry and how that can escalate the challenges that they may be experiencing in the healthcare setting. We know that women tend to be primary caregivers. We also know that there hasn't been a lot of research on life changes for women, particularly menopause, and how that can impact our own health and well-being. And so I just think about how all of those things multiply when we also think about the stresses and difficulties and organizational challenges that happen for women in healthcare, and then add all the rest of what it means to be a woman in the world in which we live.
One more thing from a data perspective, speaking with Christine Motier, the medical director of the American Foundation of Suicide Prevention, and just our own lived experience, suicide is still very underreported because of the stigma of suicide I mean, I was working with an academic health system recently where I was advised of 2 physicians. They were men who died by suicide in the last year. And when you look up all the publicity around their death, it's a different medical condition. So I do think that it is still underreported. And I want to emphasize what Kelly said, for a myriad of reasons, women in particular are at additional risk for suicide. And knowledge is power when it comes to prevention. And we need to take action to support women for all the reasons Kelly said, and for others too.
So, Kelly, for the audience, you are the inaugural Chief Wellbeing Officer of the Division of Biology and Medicine at Brown University, and that includes the program in biology and the Warren Alpert Medical School. What can you say, or how does that inform your work?
When I think about my work, it's firmly within academic medicine. All of those that I support are supporting healthcare or medicine, biology in that sense. And I think about folks in terms of their development and their trajectory towards becoming either a physician or a scientist. And then all of those who work to support our scientists in this work. It's really been an awesome privilege to be able to come up with programs and ways to support individuals for each of those phases and stages, and work alongside the deans and the people who build curriculum and student affairs who build how we do medicine and how we do our work to create environments that feel safer.
Yeah. Corey, I want to circle back on something you just shared about the reporting and the explanation of physicians dying and dying by suicide. You have brought up, and I have been in communication with you and with your team since 2020. And over time, you have given many interviews, done many podcasts, written many articles, received many awards. And one of the things I feel I've heard you speak more about is the reporting of the death by suicide of Dr. Lorna Breen, that it was not the timing that you would have selected, the family would have wanted. And do you feel that over time, this experience sits differently than it did in 2020, 2021, 2022, and now 2024?
Certainly. I think your whole thought about this evolves over time. And by this, I mean suicide of a loved one and one's thoughts as the family who's left behind. But certainly when it comes to the decision that was ripped out of our hands, it was not a decision we were even consulted on by the New York Times to publish her cause of death. I can't tell you how strenuously I objected to it. Sitting in the same chair I'm speaking to you in now, just incredibly emotional, begging not to have this published. Nonetheless, yes, our thought process on this has certainly evolved. And in many cases, I doubt seriously that we would have been able to have the impact that we have now been able to have if the New York Times had not ripped that decision from us. It still hurts. If I had to do it all over again, I probably would not do it all over again. At least give us some space to make this decision. That said, I think what it did for us, because we'd probably be living with this as this stigma as well, people wouldn't know that she died by suicide still, unless we chose to tell them. I think what it does is it immediately shines a light on the fact that there's this incredible stigma, that suicide is real for physicians as it is for anyone in the general population, and that the conditions that are driving physicians and others in healthcare to die by suicide are often very heavily informed by the workplace environment, and that there are very concrete actions that can be taken to mitigate or eliminate suicide altogether. I'll just tell you one that I just learned about, which is so interesting. I was working with Judy Davidson, who is a nurse researcher at University of California, San Diego, and Judy has done a lot of work on suicide in health workers. And what she shared with me is that suicide among health workers, the most common way that health workers are dying by suicide is by jumping off of the parking decks at their hospital systems. Okay. So let's talk real tactic for a second as an example. She said there's almost no hospital system in the country that has any preventive measures at the top of the parking deck. Now, if you're a healthcare leader and you're listening to this, go to the top of your parking deck, put a sign up, put 988 up, take preventive measures like there are on the top of very tall bridges. There's things like that I think are really important for us to understand, which is why we need to talk about this. The other thing, and I'm just going to pick up on the fact that Kelly is with medical students, I have yet to find a medical student who's found us, who's felt like the response by their school or health worker, by their institution, a response to a colleague who died by suicide has been adequate. So again, by talking about all of these things, it gives us an opportunity to address them for what they are, and hopefully through postvention efforts to prevent them moving forward.
I want to pull a bit from what we've covered thus far. We talked a bit about stigma. I'm going to say there's an element of shame, and we're talking about speaking about it. And I know that the audience resonates with the topic in so much as like, this is devastating and we need to do something. And many of our conversations, Corey, that we've had previously have been action oriented. Here's what we're doing. There is an act. There is a law. We are studying it. There's another S. I like alliteration. You, in one of our episodes, talked about peer support. I'm wondering if you can update us on peer support in your world and with the people you're speaking and working with. And Kelly, I'd love to hear with the peer support you've developed or has already been developed and is developing in Providence, Rhode Island.
Because of the concerns around stigma and confidentiality, it is critical that whether we're talking about mental health treatment for healthcare professionals or peer support, that regardless, this is done in a highly confidential manner. When you ask healthcare professionals what they want, is they want someone who's had lived experience like them, and they want to be able to process that lived experience. And so one of the most effective ways to do that before people get to needing formal mental health treatment is by creating confidential peer support programs like what Kelly has developed. They're very effective, and they are what the workforce is asking for. And I think that's really important for healthcare leaders and those decision makers to understand. And they're even asking for that in many cases before, or they're asking for, mental health resources and other types. Now, those are not the same thing. And it's important for listeners to understand they are not the same thing. But if you just think about it from a numbers game and you think about the fact that the general population, of which health workers are included, experience mental health challenges about a third of the time, 2/3 of the time, we're not talking about formal mental health. And you can get 2/3 of the issues addressed, if you will, through a peer support program. So that's what we're seeing. And we're seeing them proliferate across the country as well.
I agree. At the Warren Alpert Medical School, we have a program that's run by students. It's called Student Health Council. And it's been around for a long time. It was a privilege for me to come into my job and have this program already exist. It is supported not just by myself as a chief wellness officer. I attend all of their meetings, but our local Rhode Island's physician health program, one of the leaders from that program attends every meeting so we can support the students who do the peer support. They can ask us questions. We can make sure they get what they need. And what's really neat about this peer support program, they not only support the students in the medical school, but they support our graduate students in the Gateways program, folks who are interested in going into medicine. And we also have a program for students who are accepted into the medical school from undergrad. We support those students as well. It is really helpful for folks to have a peer to go to and then be able to escalate things if they need to. The talking about it, folks sometimes don't understand the power of conversation. So I'll just share one little example is that we do a suicide conference every year. So we're talking about it, get everybody talking about it. And we had a student who reached out to one of the deans who had a situation within their friend group. And they said, because we say so much about it here at the medical school, they didn't have a problem reaching out because they knew it was safe to ask somebody because we're talking about it so much. And this is the difference that it makes to make it known that it's okay to talk about it here. We're going to say it over and over again that this is important and that folks can speak up. And we're going to start the conversation first as an org.
Yeah, that ties into this year's conference at Brown, September 25th, Suicide in Healthcare and Science, from Awareness to Actions. I wanted to ask you, Kelly, Corey talked about sort of this feeling that students don't think their institutions do a lot, react, support. What is your reflection on that? Does that sit with you, resonate with you? Like, yeah, I can see that, or, well.
As someone who does this work, I can see that because I've been working in the last 8 to 10 years to grow the work wherever I've gone and the places I've had the opportunity to work. I've seen the changes, not only in the own institutions that I work in, but in the culture in medical schools over the last 10 years. It does not look the same as it has before. And every school is at its own level of change, but change is coming. And so I can get why students say that because, again, we often are behind them in what they need. So we're making changes, but we're just kind of catching up to what people need. So there's constant need for growth in this area. And we have to listen to students' voices so that we can get better and better at it. And hopefully we can catch up and surpass them and get it right all of the time, because this is life or death that we're talking about.
100%. So it's not just peer support in terms of some of the actions. And Corey, some of the work that the Dr. Lorna Breen Heroes Foundation is doing is something that I've thought all along was very important. I'm really glad you and your team have called it out. And that's intrusive language from licensing and credentialing applications. Update us. Where are we? How are we doing?
Well, we are making incredible progress in this, and there is a very long way to go. For the listeners, and I'm going to connect this to the federal law for a second that we helped create, the Dr. Lorna Breen Healthcare Provider Protection Act did a number of things. But one important thing that it did was it provided resources to the CDC to research the causes of suicide among health workers. And they published, the American Hospital Association, in coordination with the CDC, published a suicide prevention guide a couple of years ago. And in that, it identified 3 key drivers of suicide among health workers. And those are the behavioral health stigma and concerns around loss of license, limited access to behavioral health treatment, and job-related stressors. So those were the 3. So our work to remove these barriers to mental health access goes to that very first item there. And one of the things that we understand is that stigma comes in different ways. It comes from internal, what you're telling yourself, external, what your friends and your society around you tells you, but also institutionalized stigma, those trappings that stick you into the stigma and reinforce the stigma. And in this case, as you're aware, but many of your listeners may not be aware, licensed health workers in the United States are asked inappropriate questions about their prior mental health diagnosis and treatment, which run afoul of the Americans with Disabilities Act. And despite that, they are asked these questions on their licensing application and their renewal applications to work in a state, their hospital credentialing applications and the peer reference forms, their commercial insurance credentialing applications, their malpractice applications, their life insurance, goes down the list. It's like a minefield that the workforce has to walk around. And you really got to want to have mental health treatment because you really risk potentially some negative consequence. So what we've done as a foundation, and by the way, this was Lorna's biggest concern after we rescued her from New York and got her only mental health treatment of her life. So understanding the stigma is great. Understanding these barriers exist. Understanding the lack of knowledge among the health workforce is lacking. We created the All-In Champions Challenge for licensing and credentialing, and it is a free toolkit that anyone can access on the drlornabreen.org website, which walks organizations through 3 phases of work. Audit your questions, change your questions, and then importantly, communicate their questions. And in order to help organizations communicate, we provide a badge for organizations to hold out, to share with their workforce, so that their workforce can see that they are free from questions around prior mental health diagnosis and treatment. Every September, this one included, we publish an updated map of what this looks like and how we've changed it. This past year, in 2023, we began the year with over 20 states for medical licensing, which we'd awarded the badge to. We are now up to 30 states with a goal this year of all 50 states. We've also added dental nursing, pharmacy, and then within states, credentialing badges for hospitals. So the new map that's on our website shows this incredible progress. The last comment I would make on this subject is that this work is in a change matrix where you have impact on one side and effort on another. This is the quadrant everybody wants to be in. This is high impact, low effort. This can take a very short amount of time. And just to put one number on this for you, we have now given out badges to licensing organizations and hospitals, which represent and include over 1.2 million healthcare workers in this country. So we have a long way to go, but we are got a lot of momentum. And if any listener is interested in doing this work, it is something that you have all the tools and access to take action immediately on our website at exactly no cost to you to do so.
Thank you for that. The name of the podcast is The Visible Voices, and I ask my guests, when did you realize you had a voice, and when did you start using that voice? And it struck me, Corey, I don't think I've ever asked you this question or this series of questions. So Kelly and Corey, I'm going to ask you both. And Corey, we met in 2020 after this life-changing event with Dr. Lorna Breen. And so I'm wondering if you were to reflect on your voice, and I'll have you take the question second so you can think about your voice, because you are a healthcare executive, you are an attorney. So you have been using your voice for many, many years before you and I met. But I'd like to have a reflection of your voice. And Kelly, you are the first Chief Wellbeing Officer. You certainly had a voice before this position. And I'm wondering, when did you first realize you had a voice? When did you start using that voice?
I believe my voice has grown really slowly over time, and it's still slowly growing. But I remember the first time I realized I had a voice, I was shopping with my sister. I have a sister who's younger than me by 2 years. We were shopping. It was during the holidays. And you know how they would set up these tables to have people wrap gifts. And so my sister and I, and we might have been 12 and 10 or 11 and 9, something like that, right around in those ages. And we had gone to get our things wrapped because it said free wrapping. And I don't remember what the people did, but they did something wrong to my sister. And I remember saying something about us taking our business somewhere else. But that memory, when you asked that question, I think it was at that age that I realized that I have the ability to speak up. And it wasn't at that moment that I realized I had the voice. It was in the days later that my sister kept telling this story over and over again to other people. And I realized my actions can have an impact on others. The way in which I show up for someone can have this lasting long-term impact. And I think over time, I've tried to grow that kind of voice of being able to care for someone in a way that has a lasting impact and hopefully cause a chain reaction that it improves care for someone else. And I think this is the reason why I love working with healthcare workers and working in academic medicine, because it has that cascade effect of that positive chain reaction. So I'm still growing my voice.
So good. Corey?
Resa, it's hard for me in some ways to differentiate my voice from Lorna's story. I felt that her story, and Jennifer, her little sister, my wife, felt like her story needed to be told in the way to honor her legacy, not in the way that it was originally reported, which is why we did the Today Show through an abundance of emotion and tears 24, 48 hours after the New York Times published. I think that, like Kelly, it's grown over time, but at some point, you build the confidence to feel like what message you're carrying and the stories you're sharing can have the impact that you want it to have, and you just don't stop. And I often have said, I will stop talking when people stop calling and asking for my advice. And so in some ways, my voice began against my will, at least my national voice began against our will, about 48 hours after my sister-in-law died. So April 28th, 2020 would be that first day. And it is built since then. And what I will just end by saying is what we've tried to do with that is recognize that my voice is really the culmination of the thousands of voices that came at us after Lorna died and continue to come at us, who are healthcare workers who are longing for another day. And so it gives me additional confidence to speak to you today because I know that I'm representing their stories and I have that power and that additional knowledge from them to share on their behalf because they don't feel like they have a voice where they're working. And so it's this incredible honor to carry this forward, which is why I'll stop using my voice when people stop listening and stop inviting me on their amazing podcasts with my friend Kelly.
I'd love to end the episode by asking each of you just one thing. What is just one thing that you would offer to audience members that they can do? Corey, why don't you take it first? Kelly, second.
Because I'm a lawyer, I'm going to parse that into 1A and 1B. The number one thing you can do is tell your story. Tell your story and look out for other people. That's B. The 1C now is you need to share with everyone 988. This is the 911 for mental health. If you're looking at one thing you can do, share that number with someone else.
Thank you.
If I could add anything, I guess my one thing would be don't underestimate the power you have in taking the time to listen to someone else. Listening is a superpower and we all possess it. And if we just take the time to listen to at least one person in our day, we have the power to change a life and to be able to give all that support. So if you haven't honed listening skills, do it because it is such a precious gift and it's a gift we all can give.
The Resa wrap up. Special thanks to Corey and to Kelly for joining me in conversation. If you want to learn more about the Dr. Lorna Breen Heroes Foundation and the work of Corey and his team, go to the website, drlornabreen.org. If you want to know more about Kelly, her work at Brown University, and her own blog, go to kellydholder.com. That's KELLYD Holder, HOLDER.com. And finally, audience, my message for you is let's decrease shame. Let's decrease stigma. How? By increasing your speaking out, speaking up, sharing your stories, and practicing radical listening. That's all I have for you this week, audience. See you next time. The Visible Voices podcast amplifies voices in the healthcare, equity, and current trend spaces. We are a production of the People's Media Network. Our team includes Dr. Giuliano DePortu and me, Dr. Resa E. Lewis. Please find me through my website and on social media, Resa E. Lewis, MD, or through the podcast, thevisiblevoicespodcast.com. Please give us a 5-star rating on Apple or wherever you listen to podcasts. Also, please be sure to share the show with a friend. The views and opinions expressed by the host and guests are their own and do not necessarily reflect the opinion of the institution with which they are affiliated or identified. Information herein should never be used as a substitute for clinical judgment or for medical advice.